As COVID-19 looms, healthcare workers and immigration lawyers say the overcrowded and chaotic conditions for migrants stalled at the U.S. border are a, quote, public health disaster in the making. Joining me now, NBC News correspondent Julia Ainsley for us. Julia, good morning to you. Great to see you. Welcome back, by the way, because I haven't spoken to you since you returned from maternity leave, and congratulations on your new baby. Let's talk about this new report of yours. You recently spoke to one lawyer who hands out masks and hand sanitizer every morning to immigrants lined up at a bridge at the border as they report for their scheduled asylum hearings. Talk us through this, Julia.
That's right, Yasmin. I talked to Taylor Levy, who goes every morning. She just leave her house at 3 a.m. to meet over 100 immigrants who are lined up every morning at this bridge trying to get into El Paso. They are lined up because they think it's their day to come in for an asylum hearing, or at least get an update on their asylum hearing, because many of them don't know that these asylum hearings have been postponed for at least the next month, if not well into the future, because of U.S. policies. Now, they are all there because of a policy that led the Trump administration to say no asylum seekers can come into the United States if they don't wait in Mexico in the first place. But when you add a pandemic to that, it's leading to a lot of very unsafe conditions. And I've talked to healthcare workers who say they can't get into these shelters in order to provide health care, and that it's a public health disaster in the making, both for those who are lined up waiting for their hearings and in these overcrowded shelters where they have to return.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.